to, but it's also not always available to us. Sometimes they're down for maintenance or they're out on another call, and so then we're stuck to the ground. And then another resource is our patrollers, so Powder Mountain, Snow Basin. They can be called up by search and rescue and be part of our rescue. So the big help for those resort side rescues that we get. So when something happens that you do have to call search and rescue, first, nobody ever wants to have to call search and rescue, right? You want to be able to take care of it yourself, get yourself out of any situation you get yourself into. But sometimes things happen. Sometimes it's mistakes we make, but sometimes it's just luck of the draw and couldn't have done anything different. It just happens. And so when you have to call for help, kind of how long should you be waiting for us? It's going to be a while, right? So when you call, typically you're going to call 911. It's going to get routed through either the fire department or the sheriff's office, and they're going to decide that they need to use search and rescue. They then send out a page to all of the search and rescue team members. We're all volunteers, so wherever we're at, we get a page, and if we can go, then we'll go. So that means we change, we get our gear. Most of us try and keep our gear staged so that we can grab it and get out and get there as quickly as possible. We have to drive to wherever our incident command center is, so that can take 15 to 60 minutes, just depending on how far we have to go. If we're going up to Monty, if we're going to North Fork or 22nd Street. We haven't talked them into getting us lights, so we still have to wait for stoplights and wait for traffic, but it's going to take us a little while to get there. And then once we get to incident command, then we'll divide up into teams and send out a hasty team. We have our secondary team carrying gear, but it's going to take us at least as long as it took you to get there for us to get there. So kind of plan on at least, depending on how far we have to drive, up to an hour if we're a long ways away, and then we have to hike in still. And like I said, don't count on the helicopter. If we can use it, and it's in a situation we do need to use it, then we can use that resource, but it's not always something that we have access for. So what does search and rescue need from you? So we're going to talk about three main things on basically when you call search and rescue, what are you doing between the time that you decide you need to call search and rescue to when we get there? So we're going to your job is going to be to stabilize the patient, stop the downward spiral, make a clear and accurate call to search and rescue so we know what's going on and what resources we need, and then make yourself easy to find and prevent additional injuries. So those are the things that we're going to focus on today. We're going to focus more on the rescue side than searching. So since I am a physician and like the medical stuff, we're going to focus a little bit on just some basic medical things. So what you do before we get there makes a big difference, especially when it comes to the initial assessment. So typically we use a March protocol where you're looking at, for somebody with trauma, you're doing the March protocol developed by the military. So first thing that you're looking for is massive hemorrhage. So you're looking for any major bleeding that's going to cause them to bleed out. And obviously if they don't have any blood circulating, we're not going to get anything back because we're not going to be able to transfuse them with blood in the wilderness. So first goal is to stop any major bleeding that's going to be a life threat. Second, we're going to go on to the airway. With the airway, we're trying to make sure that the airway's open. So doing a head tilt, chin lift, probably stuff that you guys have had in woofer classes, specifically in Avalanche, making sure that there's not any snow that's packing their airway. We want to clear that out. Once the airway's open, then we can focus on actually moving air in and out, which is our respirations. So that's going to be rescue breathing, then going on to circulation, making sure they have a heartbeat. If they don't have a heartbeat, then chest compression. So that's basically our CPR there. Then moving on to hypothermia, making sure that they're staying warm and things don't get worse. And then the H also includes head injuries, just because that's a big thing that we're going to want to watch early from the beginning. So obviously, if you're finding anything that's abnormal in your March protocol, we kind of just go through it stepwise and you treat it as you go. But if you find something that's in the March protocol, something's very wrong, and this is going to be a hard situation to treat in the wilderness. So we're gonna focus on the ones where you can make the biggest difference early on, to where we're actually gonna have a chance to get there, and it's gonna be a rescue and not a recovery. So starting off with massive bleeding. So this is one, if you can stop the bleeding before we get there, then we're gonna be able to keep things circulating, and we have a lot better chance. So with massive bleeding, we're not looking for small cuts. We're looking for things that are gonna end their life if we don't stop them right away. Typically, what we want to start with is doing a blood sweep. So basically, you're going to take your hands and you're going to touch all over their body. So starting with their head, filling down to their neck, and then you're going to look at your hands, see if you have any blood on it. Then you're going to do both the arms. You're going to do around the trunk, around their back, down the legs. And each time you touch, you're going to look at your hands and see if there's any blood there. That's going to tell you that they're bleeding there, and then you can investigate it a little bit more. So it's going to be a really quick assessment. You're not taking a lot of time on it. One thing in the winter is you have to think about waterproof layers that they're wearing. That blood's not going to come through, so you're going to have to actually reach inside their coat, down their sleeve, up or down their pant leg, and see if you feel any blood or you find any blood. If you do, then you need to expose it and see what the bleeding's like. The gloves that you pick to put in your first aid kit matter. If you get too thin of gloves, you're going to look at a rock and it's going to tear. They just tear really easy, especially when it's cold. So you want to get something that's thicker. You can go to auto parts stores and they have mechanics gloves that come up higher, and so you're not going to get blood all over you. But they're also really thick, and so they're not going to tear so easy. So when you're working in an outdoor environment, you're going to have to be moving things around, and that won't tear on you. Color also matters. Don't get black ones. Get blue, orange, purple, something that when you do your blood sweep, you can look at them. But when you look at it and it's black, you're not going to see that blood. So you want something that's going to stand out really quickly. So that's my first recommendation when you're building your kit, is get some gloves that are going to fit what you need. Then once you find the bleeding, we're going to move on to stopping that bleeding. So when we stop the bleeding, we're trying to prevent shock. There's lots of different types of shock. Specifically, when we're losing blood, we call it hypovolemic shock. Basically, there's not enough fluid in the pipes. So if there's not enough fluid in the pipes, the pump doesn't work. So we're trying to just plug those holes. Typically, for most of our bleeding, pressure is going to work well. So direct pressure, push really hard right over the wound. I remember as a medical student, there was someone in the ER and they were bleeding. They had a small arterial bleed. It wasn't life-threatening, but it just kept bleeding, and they kept holding it. It just kept bleeding. And the surgeon walks in and just takes his finger, sets it just up from where the bleeding was, right on that vessel. Bleeding stops. With one finger, he stopped it. So if you apply accurate and appropriate pressure, likely you're going to be able to stop it, and then you just hold it. Then you can bandage it, put some pressure on it with a pressure dressing. For other wounds that are bigger, so either a gaping wound or a puncture wound or something like a gunshot where you're not able to put pressure right where the bleeding's happening and the vessel's bleeding down lower, that's where we're going to start wound packing. So you can see in this picture here, this is how you do wound packing. So wound packing, you're going to have your gauze roll. You're going to basically wrap around your finger and stick it down into that hole. Ideally, if you can feel where that pulsating is from that artery, you want to put your finger right over that pulsating portion. And then you're going to basically wrap it around your next finger, put it down, and then switch spots with your finger so that you're keeping pressure right on that bleeding portion. And you want to pack it as tight as you can so it's basically pressure, but we're just filling up that hole so there's pressure on that artery. When you're packing a wound, you can use things like hemostatic gauze. So basically it's gauze that has different chemicals in it so that it clots the blood easier. The two most common ones that you see are Quick Clot and Celox gauze. They both work in different mechanisms to just make the body clot the blood faster, and so then it doesn't continue to bleed. For cold, I would lean towards Celox gauze as a better option, just because it works outside of the body's normal clotting mechanisms. When the body's cold, our own clotting mechanisms don't work as well, and so having an external clotting system is going to work better to stop the bleeding. So Celox is something that you can look at adding to your kit too. The downside to the Quick Clot and the Celox is they're pretty expensive. It's like $40 for a pack of gauze. So this is what Quick Clot looks like. It's vacuum packed, really small. It fits really good in your kit. But again, it's kind of expensive and it expires. So if you don't use it after a certain amount of time, then you need to replace it because it does have that chemical in it that will become less effective. But it's really light, and when you do have a big bleed and you need to stop it, it's really nice to have. Usually I only carry one of these because I can pack this in first into a big wound, and then I can pack behind it with regular gauze. So I'm still getting the pressure, but we have that chemical right on where the bleeding's occurring the most. So then I'll use just one of these other vacuum packed ones to follow it up if needed. So if wound packing and pressure is not working, actually just leave this up here. If wound packing and pressure is not working and it's somewhere on an extremity, then you can use a tourniquet. Tourniquets are something else that I will always carry with me. In most wilderness first aid classes, they show you how you can improvise a tourniquet. If you're bleeding that bad, you want something that's going to work really well and work really fast. So I actually carry quite a couple of these with me. I keep one on my chest rig on SAR call out so that if I need it for myself, I can access it quickly and I can put it on. And then I have a couple more in my first aid kit. Sometimes you need more than one to stop big bleeds, especially on the larger low extremity legs. So with tourniquets, can I get a volunteer? Can I get someone that we can put it on? Yeah. Sweet. So with tourniquets, typically if you're putting it on yourself, you want the red portion towards your heart so that when you put it on, you can pull it and it'll tighten down quickly. And you're not trying to reach over here to tighten it down. If you're putting it on somewhere else, then it doesn't matter as much. So when you put it on, if you step this way so I don't mess up my things. So you put it on, you're going to tighten it down as tight as you can. For military situations, they always say, put it on high and tight, so as high up on the arm as you can. That's because somebody's shooting at them and they don't have time to figure out where the bleeding's coming from. So in most of our situations, you're going to be able to identify where the bleeding is, and you can go 2 inches above that bleeding spot. So if we say, okay, he's bleeding, we say he's bleeding right here, right at his forearm. 2 inches above is going to go right over his elbow. You don't want to put it over a joint because that's not going to tighten down where you want. So you have to go above the joint. So we're going to come just above that joint, and then we're going to tighten it down. One of the main things that we see when people put these on wrong is they don't tighten it with the Velcro first. So you really need to just pull on it as tight as you can, and it should start to hurt when you're cinching down on it. We're not going to do that to you though. So you need to tighten it down as tight as you can, and then you put the Velcro around. Then you start twisting this, and you twist it until the bleeding stops and you can no longer feel a pulse in the extremity. Then you know that, okay, we're good there. You don't want to do it with, you don't want to twist down on your actual ones. Get a practice one, because once you twist it, then it's no good anymore. Okay? Any questions about tourniquets that anyone has right now?
Is it okay to put it over jackets?
So if you need to put it over jackets, you can. Ideally, it's better to get low. It depends on how much padding's there. So something that's fluffy like this, you may not get, or if you have more thick snowmobile suits and stuff like that, it may be harder to do. But then we have to balance okay, how much exposure are we giving them to how much we can get it to stop. So you can try and put it on first and see if you can get it to tighten down. You can get them pretty tight and they do a pretty good job, but you have to make sure you get all of that extra out of it because you can only twist it so far before you run out of this inner material to twist. So you have to really crank it down when you're getting the Velcro on it. Once you do twist this around, then you slide the windlass into the slot there. You're going to take the Velcro, thread it through. So we got it around. You're going to put the Velcro down through there so that when you're transporting them, it doesn't get knocked out. And then you're going to close this so that everything stays secure in there and it doesn't actually come off. You do want to check them frequently to make sure that it's still tight and it's still working. Sometimes as you do transport people, it starts to slide, especially if it's over clothing, and then you need to readjust it. And like I said, sometimes you do need a second one, and you just put that one right above the first one. Tighten it down. Tourniquets for quite a while, everyone's like, oh, don't do a tourniquet, like they're going to lose the extremity. There's a possibility. We start seeing permanent tissue damage from tourniquets because there's no blood flow at about 2 hours of it being on. And depending on where you are in the backcountry, it's very possible that your rescue could take more than 2 hours. Usually around 4 hours, we see a pretty big change on how much tissue damage we have there. But again, we're kind of balancing risks, right? So we lose we lose an arm or we bleed out and they die. So we have to balance those risks. Again, that's why we're trying not to do high and tight if we can identify where the bleeding's coming from. We want to keep it as lower. So if we do lose some tissue, we're down lower and not losing the whole arm. All right. Any questions about that? So here's a little graphic that kind of helps us know where do we use what. So tourniquets, obviously on the extremities, you can't use a tourniquet for head bleeding. Please don't do that. Heads bleed a lot, and they can be scary because it's always running down their face and it just seems like it's not going to stop. Pretty much all head bleeds can be stopped with pressure. You just may have to hold it 15, 20 minutes, but it will stop. So in the junctional areas, that's where we're going to use the packing only because we can't use a tourniquet. So that's going to be in the neck, kind of upper shoulders, axillary areas, the armpits, and in the groin. That's where you're going to pack. This green box in the middle, that's in our chest cavity or our abdominal cavity. Do you want to pack a wound that's in the chest? No, you don't, because there's nothing in there, right? So it's just an empty space with our lungs. So if you start packing gauze in there, there's nothing to put pressure on. You're just going to fill up and collapse the lung. And so for if you have a large wound that's open in the chest, we're going to use some sort of occlusive dressing. So that can be taking one of the wrappers off of your gauze and taping it around so that the air is not going in and out. For the bleeding that's going on the inside, you need a trauma surgeon. That's just where we're at. So you're just trying to keep that lung from collapsing more by putting occlusive dressing on it. All right, so as we go down the March protocol, so airway, pretty basic. We need to open up the airway. If they're not breathing on their own, we need to do rescue breaths, and then circulation. If they don't have a pulse, we're doing CPR. With CPR, due to traumatic incidents, the chance of recovery is pretty low. If they've had significant trauma enough to stop their heart, it's a low chance for recovery. We're going to try, so we do CPR, but I want to focus on the limited time we have on hypothermia because that's another thing that we can really help prevent and make a big difference in our early treatment. So hypothermia can happen because of exposure. You know, you fall into water in a cold environment, you've been outside too long. But also really important is in these trauma situations, like I talked about, when our body gets cold, our clotting mechanisms don't work very good. And so when we get cold and we have some sort of trauma where we might have internal bleeding or something, those clotting factors that normally stop the bleeding internally and reduce how fast we bleed don't work anymore. And so as patients get colder and colder, the bleeding continues more and more. And so if we can keep them warm, the body's able to slow down that bleeding a little bit. So any patient that has any sort of trauma in the backcountry, especially in winter, they're going to get cold because they're not moving anymore anyway. But it's really important that we heat them externally, so get some sort of heat source on them and preserve the heat around them so that we don't bleed more than we would have anyway. So we need to insulate them aggressively. So any extra clothing that you have, we're trying to throw on there so that we can get them. We talked about trauma, so in this clotting system, so hypothermia, bleeding, going to lead to worsened clotting, then more bleeding, shock, and death. So if you guys don't have this saved on your phone or in your first aid kit, this is something that I would recommend that you add to it. You can print it off as a card, laminate it. You can find it on the Wilderness Medicine hypothermia guidelines if you want a higher resolution PDF to print off and make your own card. But it's basically a front and back card where it says, okay, how cold are they? How do we assess the hypothermia? What stage of hypothermia is? And then what you should do for that stage. And then on the other side, it gives you a review on how we make the hypothermia wrap or the burrito. So zooming in on this a little bit. So when we're assessing our hypothermic patient, we basically start on these rings and we move from the outside in. So the first thing that we're going to assess is their level of consciousness. Then we go into if they're moving normally, if they're shivering, if they're alert. And so if it's green on the ring, then you just keep moving in. If it turns red, then okay, that's where we're stopping and where we see. So You can see in mild hypothermia, they're going to be conscious, but they're going to have impaired movement. They're going to have a hard time zipping up their coat, getting their boots on, moving around. You hand them some food to open up and they just can't do it. And so we say, okay, we're not taking the temperature out in the backcountry, so we know, okay, they're probably mildly hypothermic. For mild hypothermia, well, let's go back to cold stress. So this is actually where most people, when they say, oh, I was hypothermic, like they're most likely in this cold stressed area. So they just feel really cold. They're still functioning normally. They're conscious, alert, they're shivering. So their shivering produces heat. So we want people to shiver. So with that, we're basically just saying, hey, we need to move you around. Let's get you some calories, warm liquids, try and warm you up through movement. With mild hypothermia, our treatment is going to be getting them some calories so that they can keep shivering, because if they run out of energy, they're not going to be able to shiver anymore. Then on this card, it says that if you want to sit them down and warm them up for 30 minutes before they start moving. There's been some recent research that shows we can actually move them a little bit earlier, especially if they've already been moving. So like if we go on a call out, we had one over on near Nordic, and somebody had been hiking. They fell maybe into this mildly hypothermic area, but they had been walking. And so we weren't going to sit them down for 30 minutes and warm them up. They'd already been walking, their muscles are already warm. We're just going to keep walking them and warm them up more. But if you find them and they've been sitting there for an hour already, then you probably want to start warming them up with our hypothermia wrap that we'll talk about for 30 minutes and then start moving them. The reason is after drop, which we'll go into more, we don't want to make them more cold by moving blood to their cold extremities and then sending that cold blood. It gets refrigerated as it goes into their arms and legs back to their heart, and then it cools down their heart more, and then their heart goes into a weird rhythm. So for mild hypothermia, if they're already sitting, warm them up, then move them. If they're walking, keep them walking, give them calories. For moderate hypothermia, that's where we get into impaired movement and they're not shivering and they're no longer alert. So they're not answering questions clearly, they're not making sense, they're just doing things that seem off. For this, you don't want to feed them because they're not in full control of their body, so there's a chance that they're going to aspirate or choke on the food that you give them. For them, we're in a very dangerous area where we could move to severe hypothermia, where they become unconscious and their heart potentially stops from the after drop. So we want to put them in the wrap right away. We want external heat because they're not shivering, or they may not be shivering as much, and so they're not producing any heat. So unless we give them heat, they're not going to warm up at all. And then it's really important that we handle them gently so we don't agitate their heart muscle that's so cold that it can go into these weird rhythms. And then for severe, if they're unconscious, we count that if they're unconscious and cold, then we count that as potentially severe hypothermia. You want to check for a pulse. If heart slows down when you're really cold, so you need to check for 60 seconds for a pulse. If you don't feel a pulse after 60 seconds, then you can start CPR. We don't want to do it sooner because if their heart is in a normal rhythm, it's just so slow, and then we start pressing on their chest, that's going to agitate that cold heart, and then it's going to go into a weird rhythm, and unless you shock them, they're in trouble. One thing with severe hypothermia, if you are doing CPR, you can do intermittent CPR, meaning you do CPR for 5 minutes, then you move the patient without CPR, then you do CPR for 5 more minutes, then you move them for 5 minutes. So then you can actually get them out of the cold environment. And where they're severely hypothermic, they get better brain tissue preservation because they're so cold, they're using less oxygen. So our hypothermia wrap, the burrito, with this, we're basically taking multiple layers to try and protect them from the outside environment. And then if they are wet, keep our insulation warm. So usually I will start with the bottom layer and just kind of build it up, put them in, and then wrap everything around them like you would a burrito. So the outside layer is going to be some sort of tarp, waterproof layer. So that's going to protect them from any wet environment or wind around them and keep that from getting everything wet. So that's going to be our bottom layer. Then we put some sort of insulating pad so that they're not losing heat into the ground. Then we have our insulating layer. So ideally a sleeping bag that can pull up and tighten around their face so that we don't lose any heat around there. And then we're going to have an inside, what we call vapor barrier, so that we're not losing any, or if they are wet, or if they're transported for a long time, then they may urinate, and then it's going to get all of our insulating layer wet. And so we're trying to keep any water that's on them in there and not get our insulation wet. And then we put in our patient with some sort of heat. So either a heat blanket, you can use the Ready Heat, which is ideal. They come in packs like this, kind of a lot for like a small first aid kit, but when we're expecting to go on a rescue, this is kind of what I'll bring. It's just like a large chemical, has multiple chemical heat packs. So you open it up and it'll cover the whole torso. With chemical heat packs, they've done some research to figure out, because usually the instructors are like, open it up, shake it for 15 minutes, and then apply it. They've done some research specifically with these larger blankets. You open them up, shake them for 2 minutes, then put it on the patient. It'll actually warm them up faster than shaking it for 15 minutes while they're over there shivering. If you shake it for 2 minutes, it'll activate it enough, you can put it on them and then warm them up a little bit faster. If you don't have a larger heat blanket, you can use body warmers, like the smaller body warmer chemical heat packs. We found ones that have like a sticky adhesive portion to it, so they can just stick it onto their clothes, and it works kind of like these larger blankets. Usually they don't recommend on the Wilderness Medical Society guidelines these small hand warmers, just because they don't produce enough heat to make a big difference. So if you can carry some of the larger body warmers, that's going to be better for you. If you do have some sort of stove with you, you can warm up water bottles and then stick the water bottles on their chest and their armpits. Those are kind of the areas that we want to warm, is the torso. Typically, we don't want to put anything on the back, because when they're laying on it, cold skin's really sensitive and it'll burn them. Same with the heat packs or body warmers. You want at least one layer between the body warmers and their skin, so that it doesn't burn their skin. And you want to check it every hour to make sure that it's not getting too hot. You need to rotate the locations. So once they're in there, you kind of fold everything up, cinch the insulation down around the best you can, and then you're ready to go. So as far as after drop, we mentioned earlier, so basically this is continuing to get cold even though they're removed from the cold environment. So it can drop the temperature up to 5 to 6 degrees Celsius. So it can easily move somebody from that moderate category to severe category where their heart stops. Basically, it works, like I mentioned, the warm blood comes from the heart, gets pumped out, it goes into the extremities that are colder, and all that muscle tissue has cooled down, and it cools the blood off, and then it goes back into that heart, and now we're just sending cold fluid into the heart, which makes the heart colder. Things like standing people up, exercising, anything that's going to cause more blood to flow down into the legs or out into the arms is going to make this worse. So that's why we have them just relax, lay down, not move too much, so that we're not worsening this. Also putting them in warm water, that's going to dilate all the blood vessels, and then blood's going to go out to the extremities, and the cold is going to come back. So if you have access to warm water, don't put them in warm water. So most people are not carrying, a full kit and a sleeping bag and a foam pad and all of these things for our hypothermia kits. When we come out on search and rescue calls, then we divide up all the pieces and we try and carry everything with us. But what is something realistic that you can carry with you? So we talked about the chemical body warmers, having a couple of those that you can carry in your kit. Usually I recommend these survival wraps. So there's the Mylar, like space blankets that are really small. Those tear really easy, and they're usually not big enough. So these Mylars, or these rescue wraps, have Mylar with a polyethylene coating on the back. So it's actually 2 layers. And this one I've used, I think, for like 3 or 4 first aid classes, like wilderness first aid classes, and wrap people up on it on the ground and stuff. And it's still pretty well intact. We don't really have any tears there. So it does way better at staying intact, and it's way bigger. So you can actually wrap somebody all the way up with this. So if everybody in your group has that, you can easily have 1 or 2 to wrap the inner vapor barrier and the outside vapor barrier. And then in between that, you can put, your extra puffy coats, extra layers. If you only have one of them, you can use like your your Gore-Tex shell for the outside to try and just keep your insulation as dry as possible. Has anybody seen the Airbase pads? So these are pretty new. You can buy them from Rescue Essentials. It's basically like a little air pad you can see in this picture. So it's this small, and then you blow it up, and then you have like an inch of insulation. It doesn't have a great R value. It's like 1.25, so it's like an inch of plywood equivalent with R value, but it's better than nothing to get them off of the snow and makes them more comfortable. Cool thing about these two is they have individual baffles, so if like one of them gets popped, then it's not all going to completely deflate. And it's really small, so if you have these two, you can easily slide this in like a leg pocket or something like that, and then you've got a really good kit to start off with, and then you already have some insulating layers. All right, so common hypothermia questions that I'll get at classes that we do. So one, how effective is fire? They're like, I'll just build a fire and then I'll warm up. Typically, if somebody's really that hypothermic, it's not going to be super effective. Think about the last time you went camping and it was really cold and you didn't want to get up. Would you rather stay in your sleeping bag or get up and go stand next to the fire? Like, which one's going to keep you warmer? Most of the time, unless you have a great big fire and some way to reflect the heat around so that it bounces back at them and some sort of shelter to hold that heat in, they're going to be way better off in sort of hypothermia wrap versus trying to build a fire and warm them up that way. That being said, fires are really good psychological first aid. So having a fire close by is helpful, but it's not going to be the best way to warm somebody up. We talked about hand warmers, it just doesn't produce enough heat. With wet clothing, should we remove the wet clothing before we put them into the hypothermia wrap? If we go back here, so on the cold card, it has instructions on what we should do. So if they're just a little wet, say they're just wet from melting snow and it's just a little damp, just throw them into the hypothermia wrap. We don't have to remove any clothing. If they've actually like gotten soaked, it's raining, or they've fallen into a wet environment, it depends on how well you can protect them from the environment and remove that clothing and how long it's going to take to transport them. So you can follow the instructions. So if it's less than 30 minutes away, then you're just going to wrap them up. Actually, having a little bit of moisture in some of the studies they've done has been shown to warm people up faster with the heat. It kind of moves the heat around faster. But if it's more than 30 minutes and you're able to protect them from the environment, then you can try and remove some of that drenched clothing so that they're not having to heat up all of that extra water. And then body-to-body rewarming. This one's everyone's favorite question. Like, can I climb in the sleeping bag with my buddy? You can. So the important part is that your torso is next to their torso. So usually what you'll do is the person who's hypothermic, you would climb into the hypothermia wrap behind them. Clothing from the waist up, except underwear, should be removed. You grab onto them, basically pull them into you and try and transfer that heat directly from your skin into their back. So your front into their back. We typically don't do this in search and rescue. But if you're in a life or death situation, something that you can look at. Yeah, call numbers are going to go down. All right, so any medical questions on hypothermia or bleeding? So those are the things we're going to cover medical-wise, and we're going to kind of get into some of the other scene management and like calling. So the second point that we're working on is making a clear and accurate call. So incorrect information can delay a rescue. John Soul, who's been on our team for a long time, he always says, we get 50% of the information that we need, and 50% of that information is incorrect. And so, we try and plan for everything so that when we get there and they're like, hey, there's somebody who's stuck on a cliff, and then we get there and there's 4 people, we have the extra gear that we can use and improvise sometimes to get those people out. And so the best information you can give us, and the earlier we get that information, the better decisions we can make on whether do we even need to send a ground team as our primary, or should we just be calling a helicopter because it's that severe? And then what kind of team should we be sending? Should we be sending the moto team? Should we send the horse team? A lot of times we're going to have a couple backup plans. So even if we send a helicopter, I mean, we had a call a couple summers ago where at night the helicopter came by and they circled 3 times in 3 different attempts. They never ended up being able to land where we were at. So luckily we'd already sent the moto team was already up there, the horse team was already on their way, and the climbers were already walking up, so that we had different plans on how we were going to get them down if our primary didn't work. And so if we know what we need to take and what kind of gear we have, it just helps us out a whole lot. And then kind of making sure you have your emergency contact plan in place. Like, are you going to have cell service where you can call 911? If you can't call, can you text 911? Because some places you can't get a call out, you still can text. Or do you have your inReach or your Spot or whatever satellite messenger you're using? And then do you have a battery backup for that? But you are essentially, as the person up there, and a lot of people, I know there's a lot of patrollers and guides and people with a lot of experience, you're basically telling us what we're walking into and what kind of things we should prepare for. So we need you to be our eyes and our ears. So this is kind of just a template. This is not like, this is exactly the information you have to give them. This is just some ideas of what kind of things you should think about when you're calling in to request a search and rescue assistance. And usually you think like, oh, these are obvious things, but like sometimes in emergency, your brain just goes blank if you're not used to those situations. I had an experience where someone was saying like, this was going on, I went to call 911 and I found the 9 and I couldn't find the 11 on my phone. And so it took a couple more minutes to call. And like, that was like a legitimate concern that they had. And just their brain was not working to say, oh, I could push 1 twice. They were looking for an 11. So having sometimes some resources that you can just refer to help in those situations. So the 5 main things that we need is 1, where are you? 2, what happened? 3, what did you do about it? 4, how are things now? And then 5, what is our contact plan going forward so we can stay in communication? So where are you? The best thing you can do is give us coordinates. So if you have some sort of way to give us coordinates, that's helpful. We can just put it into our map. We can see exactly where you're at. If you don't have access to that, then just the nearest landmark or drainage where you're at, we'll figure it out. Then 2, what happened? So what were they doing? What happened? Were they skiing and they went off a cliff? Was there an avalanche? Did somebody get lost? Did somebody fall into the river? Did they smash into the tree on their snowmobile? Did they get run over? What kind of things happening? When did it happen? And then how many patients do we have? Again, that's happened before where we thought we were going for 1 person. We end up having multiple patients, and then that changes our plan a little bit. If you have the name of the patient, that can be helpful. And then kind of giving us our basic rundown. Are they conscious? So if you've heard of AVPU, that's an easy way to think of what is their level of consciousness. So are they alert, verbal? Are they responsive to verbal? So like if you walk up to me and talk to them, they'll groan, they'll move when you talk to them. If they're in pain, so if you squeeze on their trap or you pinch their fingernails, do they try and pull back from you? But otherwise they don't respond to you. Or are they just completely unconscious? So that's helpful for us to kind of know how severe the injury might be. Obviously, if they're breathing, is their breathing labored? Are they trying really hard to breathe or not having effective breathing? Do they have a pulse? Any major injuries that you find in your March exam? And then any past medical history, if it's a medical thing. If somebody has a known history of heart attacks and they're having chest pain, it's good to know, like, hey, they have a pacemaker or they've had heart attacks in the past. For more of like a medical type thing. And then what did you do about it? Did they injure themselves and you had to splint something? Were they bleeding? And then is that bleeding controlled? Did you feed them? Did you get them water? Helpful for us to kind of know. And then how are things in the group now? So how many people total are in your group? That tells us what kind of resources are there, what potential further complications there could be, how many people we're gonna have to try and transport out. So if, say, the patient's injured enough that we have to fly him out on a helicopter, do we still have a large group there that needs help getting down still? Do you have resources to where you can shelter overnight? Bivvy, stove, extra layers, food and water, so we know if we need to bring extra stuff for you. And then it's helpful to know what what the group's currently wearing when we're searching for you. Sometimes we find other people and it's not the people we're looking for because we don't know what kind of clothing they're wearing. It can be helpful if you feel confident, and again, a lot of you guys are very experienced in being outside and the outdoors. So what is the weather like you? Because sometimes down at the trailhead is different from where you're at up there. What is the visibility? So are we going to be able to use air resources with drones and helicopters? How much wind exposure you're getting? Again, difficult to fly in certain areas. And then what kind of terrain do you have? Is it open? Is it steep? Is it flat? Is it somewhere we could potentially land a helicopter if we needed to? Or are we going to be all ground? And then the best contacts. So if we lose contact with you, can we call back? If you have radios that you're using in your group, what channel are you on? Because we can program our radios so that we can start to communicate once you get up there if you don't have service. And then how much battery do you have left? That's usually people will call us when they have like 1% left on their battery, and they hurry and say like, "Hey, I'm lost, come find me," and then it's gone. And so knowing how much battery you have so that we can call back, and if you don't answer, we know, okay, their battery probably died and like something terrible didn't happen to that person. And then obviously telling them your name so we know who we're talking to. All right, so make yourself easy and to find and prevent additional injuries. So you are now part of our rescue system, especially if you are a guide and you have a group or somebody else in your group's injured. Like, we need your help to kind of make sure that things run smoothly once we're on our way and when we get there. So unless it improves your safety, try and stay in the same area. Especially if you were able to call and then like your battery died, we can triangulate and get kind of a general area from your call and cell towers. It's not always super accurate, but we kind of know what general area we're looking for. And if you tell us where you're at and then you move and we get there and you're not there, then we're still looking for you. Wearing bright clothing, putting down anything that looks unnatural. So putting your skis down in different formations so that we can see it from the air. Our drones can pick up a lot of stuff, but it's easier to see if it's flat on the ground. If the drone's hovering above you and it looks down, it just sees the top of you and you're not going to be seen as easy. So if you can spread something out on the ground, it's easier for them to pick up a lot of times. And then obviously at night, lights are very helpful. Another big one is kind of managing hazards in the scene. So, if there's an avalanche or we have hang fire that's going to come down, are there additional risks? Like if we're doing high angle stuff, are more people going to fall? Are you going to put any rock fall that comes down on rescuers as we're coming up? So trying to keep the group in an area that it's not going to cause more injuries. Because we don't want to have to rescue somebody else from additional injury that's going on. And then kind of preparing for like how long it's going to take us. It's potentially going to take us several hours to get there. And so kind of setting up camp for a little while and making things better for yourselves. And then typically you're going to be, if you're on the phone with somebody, you're going to be talking to one of the deputies. They're going to give you instructions. Just try and follow those instructions the best you can. And then give feedback. Tell them if things are changing, so that we know kind of what we're walking into. All right. This applies specifically if you have a leadership role in your group. So if you're a guide or something, so assigning roles to people, maybe people who aren't as experienced, having a friend or somebody in your group injured can be very traumatizing, can make people anxious. People do weird things when they're stressed. And so trying to give them a job so that they can stay focused on something and be helpful for the whole group can be really important. And then kind of grouping resources, say, okay, what do you guys have in your first aid kits? What layers do we have? How can we keep this person warm? Kind of coordinating that so that it's not just a whole bunch of stuff kind of happening all independently, that you can work together as a team. And that'll just help us when we get up there. We know what resources we have and we can prevent any additional injuries or people wandering off. So here's a couple things from our drone, just so you can kind of see what it looks like when our drones are looking for you. So over here on the left, that's our thermal cameras. You can see these dark spots. Those are our patients and the rescuers together. And then on the right side, you can see what it looks like just looking down when they've got the spotlight on, and you can see their headlamps. It's kind of hard to see on this, but you can see the glow of their headlamps in the middle. So much easier to see on thermal. So that's a huge tool that we have. Here's another view from our drone. So this is kind of a view of our spotlight and kind of how much you can light that up. So that's what you're looking for. Usually if the drone finds you, they'll fly over you and they'll put the spotlight down on you. So then you know, okay, they've located us. This bottom picture is actually a screenshot from my phone. So we have the ability on a lot of our drones that they can actually broadcast. If we have service, they can broadcast the footage from the drone, so then we can see what the situation is, where they're at, and it helps us find you faster and prepare for what kind of treatment, even like based off injuries that we're seeing on that. And then again, with this larger picture, you can see our group there. There's a lot of, again, it's harder to see, but the reflective stuff stands out a lot. So if you have any clothing, usually headlamps have like on their straps have some sort of reflective on it. That stands out really easily for our drone. Let's see if this works. So this is a video from a rescue that we were on. The patient's this bright spot in the middle. You can see a couple rescuers that are skiing down to them. This is thermal. You can see the top of the snow is cold. The lower part's actually a little bit warmer. So you can see them working their way down. So they're all working their way down, and then here in a second they'll switch over to their zoomed camera, which is just the regular camera with the spotlight. They can zoom in pretty close, so we can get a good idea of kind of what's going on with the patient. So that's kind of an overview of our drone capabilities. Again, they can do a lot of cool stuff with our drones. In this picture, this is what the drone looks like. Looks like a bright star, so that's what you're looking for. You'll hear a buzzing sound usually if they get close enough, flashing red and green lights. So kind of to summarize, stabilize the patient, provide the medical care that you have to your level of training, communicate early. We'd much rather get called where you might need a rescue and we can get on our way than you waiting an hour and then being like, oh yeah, we actually do need search and rescue, and now we have an hour to get there and then an hour to get up to you. Just call us early, we're fine to turn around. If it turns out you don't need us, and then just make sure you don't become the second rescue. Manage your scene wisely while you're waiting for us. All right, that's all I got. Anybody have any questions? What was that? So yeah, so we have a drone that it won't carry people, but we can put our litter on it and like ropes and stuff, and they can carry it up to us, and it can lower it down. So then we can move up the mountain faster, not having to carry so much gear. Yeah, it's really cool. There are videos on the internet circulating in other countries where they are rescuing people. It's not recommended. The weight limit's, I think 110 pounds is like the maximum that they recommend. But yeah, it can lift a lot. All right, well, email's up here. If you guys have any questions, feel free to email me. If you're interested in any more wilderness medicine learning, we're doing classes every once in a while with a couple people here in the community. So hit us up. Well, let us know you're with Ogden Avalanche.